Hi everyone, Dr. Linder. In this short video, we're going to be going over some of the key parts of the eye that I'd like for you to be familiar with. I know in lecture you're going over a little bit more in terms of function, but here we're going to focus primarily on structure. So this is the individual's right eye, just to give you a little bit of an orientation. So right here would be their nose, and then their other eye would be here. Okay, so this is their right eye. So this is lateral, and this is medial. Okay, so right in the center, right, we have the pupil, the colored portion of the eye from here to here. That's the iris. And then the white part of the eye from here to here, that's called the sclera. Okay, sclera should be white. Also notice that in terms of the iris, we see the full iris on the bottom, but we rarely see the full iris on top. The only time you would ever see the iris on top, you see it with people that have thyroid issues, especially hyperactive thyroid. They get what's called exophthalmos, where the eyes sort of push out a little bit. You could see the sclera or the white of the eyes all the way around. It's one of those diagnostic physical findings of hyperactive thyroidism, is seeing the sclera all the way around and seeing the full iris. The lateral part, this lateral corner here, is called the lateral canthus. And if there's a lateral canthus, you're going to have a medial canthus as well. And of course, you have your eyelashes. The upper lid is called the superior or upper palpebra, and then you have an inferior palpebra. Oftentimes we'll take the inferior palpebra and we'll pull it down a little bit to look on the inside to make sure it's nice and pink and not white. It typically shows up white with people who are anemic, or they have iron deficiency anemia or B12 pernicious anemia. The flow of tears going through the eyes, right? The eyes, everything in the environment hits the eyes. It's very dirty fluid in the eyes. So we have the lacrimal gland right here. We have the lacrimal ducts here. And this is actually the flow of tears. If you look on the right, it goes from the lacrimal gland to the lacrimal ducts, and then it goes into the lacrimal puncta. Okay, so the lacrimal puncta, you'll see that it flows in this direction, like superior lateral to inferior medial. Okay. You'll see as it flows in this direction, it's now going to go into the lacrimal punctum next, into the lacrimal sac, which is right here, then into the nasolacrimal duct, which is here, into the nasolacrimal canal, and right into the nasal cavity. Now, as it goes into the nose, right here, it's going to be draining into the inferior meatus, right? That's the inferior meatus. This is the middle meatus, and you have the superior meatus. You have the inferior concha, middle concha, and up higher would be the superior concha, also known as turbinates. Now, because this is very dirty fluid that's going in here, your body gets inflamed and swells up in here due to histamine. So these swell up and engorge, they enlarge due to histamine. And that's why you get like a drippy nose and a stuffed nose, and you feel like you can't breathe because these turbinates kind of swell. At least the epithelial membranes around them swell due to histamine. When we look at the eye itself, we can see that the white part is called the sclera, and then this clear part the clear part is the cornea. So C for clear with the C in cornea. It's not the lens, it's different. The lens is something different. So the cornea is almost continuous with the sclera, right? It's more anterior, but as you move posterior, you get to the sclera. The pupil we see is that black circle in the center, and then the colored portion again is the iris. We can see the sclera off to the right, and we can also see some of the musculature. Right up on top, we see the superior rectus. On the inside, we see the medial rectus. On the outside of the eye is the lateral rectus. We can see a little bit of the superior oblique tendon, and on the bottom, a little bit of the inferior oblique tendon. So good place for you to kind of remember the SO4, LR6, all over 3, which tells us the superior oblique muscle is innervated by the trochlear nerve, the lateral rectus is innervated by the abducens nerve, and the other eye muscles are innervated by the oculomotor, cranial nerve number 3. Now, when we take this portion off, right, we can take this entire portion, we can dissect it so that the bottom portion is on, but the top part is removed. So now we can look at a few different layers of the eye. Let's remember, here is the cornea. I'll put a little C here. Here is the cornea. You can see the half of it at least. The other part was removed. We could see the sclera, the white part. We could see the pupil. And we can see the iris, the colored portion. Now the sclera, this is the outer layer. As we move in, we get to a more vascular layer called a choroid. So the choroid is the middle layer. So you have the outer layer, then you have a middle layer, which is the choroid. When we turn the eye to the lateral view, again, you could see here is the cornea. Now this clear portion, that's the lens right there. So that's the lens. We have 2 chambers. We have an anterior compartment, and we have a posterior compartment. The anterior compartment is called the aqueous humor, and the posterior compartment contains what's called a vitreous humor. When we take this part and we dissect it off and we look on the inside, that's where we have the retina. Now the retina is the innermost layer. So the outermost is the sclera, the middle is the choroid, and the innermost layer is the retina. Okay. Here is the optic disc. The optic disc is where the optic nerve and all the blood vessels kind of enter to pierce the eye. On the bottom, we could see half of the cornea. Here, we could see the sclera. Cornea is the outermost layer. Middle layer is the choroid. Again, outer layer, sclera. Here's the pupil. Here's the iris. What attaches to the iris is the ciliary muscle here. And then we have the choroid, which is the middle layer. You can still see the sclera. We can see the iris. We can see the opening or half of the pupil. Just posterior to that, that is our lens. The middle layer is the choroid. Innermost layer, innermost, is the retina. What holds the lens in place is what's called the ciliary muscle, part of the ciliary body, and there's many like extensions of this muscle that attaches to the lens, right? So the lens would sit right in here. This is actually right here. This opening should say the pupil. Here's the ciliary muscle. And right in here, all of this, all of these little extensions coming out, that's all part of the ciliary muscle. Okay. Here's the inner part of the eye, is the retina. The middle layer is the choroid. Here's the optic disc, where we can see the optic nerve, and we can see the blood vessels, arteries, and veins. And it is the only place in the body that we can actually see arteries, veins, and nerves without dissecting the body. We can look in with a fundoscope, and this is where they can see signs of hypertension. They could see signs of diabetes. They could pick up a lot of metabolic issues because they're looking at ratios between the size of the diameter of these blood vessels between the arteries and the veins. Here's a cross section. I like this picture. It allows us to see the three layers. Here's the sclera, which is the outermost. Here's the choroid, which is the innermost. And there's the third layer, the retina, which is the innermost. When we go to the front of the eye, we can see the cornea. Here is the iris. This is part of the iris. Here's the other part of the iris. That's the colored portion. And then the opening is the pupil. Here is the lens. And this is a really nice view because it shows you can see the ciliary muscle or the ciliary body. And then there's these little cords off the top and bottom of it, these little ligaments, these extensions, they call them suspensory ligaments, that can contract and alter the shape of the lens to alter your vision. Okay, let's see if there's anything else here, right? So here's the optic disc, which is often known as the blind spot because there's no receptors there. There's no cones, there's no rods, there's no receptors. Okay, I think that's all I would need you to know there. And again, here's another view showing the visual axis of light entering through, penetrating. So here's the cornea, here's the iris, here is the pupil, here's our lens, and you can see again the suspensory ligaments. Here's the ciliary muscle off to the right, and then you can see those suspensory ligaments right here, suspensory ligaments of the lens. You can see the three layers again. We see the sclera, we see the choroid, the middle layer, and then we see the retina, the innermost layer. Here's the optic disc. Here's the optic nerve. We could see the central artery and vein also passing through. When we look at the model of the eye, we can see the iris, the pupil. Here's the lacrimal sac. We see the superior rectus right here on the top. We see the lateral rectus on the outside. You can see a little bit of the medial rectus on the inside. We see the superior oblique and the inferior oblique. On the bottom right here is the inferior rectus, but this one going across in this direction, that's the inferior oblique. Here is the superior oblique. Now remember SO4, LR6, all over 3. So the superior oblique is innervated by the fourth cranial nerve, which is the trochlear nerve. And look at the superior oblique muscle. See how it goes through the trochlea? This little pulley right here, that's what trochlea means. And then LR6, this is the sixth cranial nerve. And then everything else that I'm not putting a number next, the other 4 muscles are going to be cranial nerve number 3, oculomotor. This is just from the lateral view. We can see the lateral rectus. Medial rectus we can't because it's a lateral view, but we can see the inferior rectus on the bottom. We can see superior rectus on top, a little bit of the superior oblique. We'll put a 4 there for the 4th cranial nerve. We could see the trochlear right here. That's where the superior oblique travels through for that tendon. Okay. Okay, when we come back, we'll talk about the ear.